Hello again. Thank you for making me part of your afternoon's journey toward more information regarding COVID-19 vaccination. As you see, a lot of my patients who have been vaccinated and majority are still not vaccinated continue to be aware of COVID-19 vaccination, and they have always this question in mind: how successful is COVID-19 vaccination? The success of COVID-19 vaccination and what our future holds after most of us have been inoculated with SINOVAC. How then can we navigate our lives when we're vaccinated and most of our friends are not? Can we now go out and meet with them, or can we now go out in public and meet with friends? So one of the COVID warnings is the possible side effects for seniors of getting back and reaching out to the family. So my octogenarians actually allow themselves to be pictured here because they want to be models of vaccine optimism. They are so optimistic that soon we can get back to our normal lives. So I hope most of my patients who are above 80 or 90s, don't worry. SINOVAC and other COVID-19 vaccines are very safe with very minor reactogenic reactions. But my precaution to most of you is that when you do post in social media, please make sure you don't share personal identifiable information on social media. The purpose of why I present to you my octogenarians, because there are a lot of people who are still not sure whether to be vaccinated or not. When we talk about vaccine optimism, we want to make sure that people understand that one way of getting hopefully back to our normal lives is to be vaccinated. Hopefully, we can get back to without masks, without the need for social distancing, and for sure, this will be possible once most of the population get vaccinated. So there will be a point in time that when we are successful in our advocacy to inform most of the people that vaccination is safe, that we can get this so-called herd immunity and get back to normalcy without masking and without social distancing. Unfortunately, at the present time, we are still in the so-called twilight zone because a lot of our friends, a lot of whom we know, a lot of my patients, I still have to do convincing to get vaccinated. And I've known that there are a lot of my patients who are desperate to get the vaccine, who up to now have not yet given the chance to get one. So why do we need to be vaccinated? Vaccine optimism. Why? Because I want to show you that we are optimistic of the future once most of us get vaccinated. In this data, you can clearly see that the new deaths attributed to COVID-19 in 3 countries, whether it's the United States, United Kingdom, or Israel, have significantly dropped since their vaccination program began. You can clearly see here that the vaccines work. So for those anti-vaxxers out there, you can show us the data that this is not working. In fact, it is. The rates of severe COVID-19 are falling, and further among the elderly who are vaccinated compared to the younger groups who are not vaccinated, all from the United Kingdom to the United States to Chile. So clearly, vaccine effect is significant. What's also very important is that you can clearly see here that cases, including ICU patient numbers, meaning going into hospital in the intensive care unit, and deaths are really climbing fast among Chile's younger population who are not vaccinated, but look at the elderly population who are willing to be vaccinated, that they are stable or falling very rapidly among those who got the vaccine. Not only that, UK has just recently released major lockdowns on April 12th, and experts are saying that COVID pandemic is now over in Britain. Why? Because of their very significant vaccination program, which has significantly reduced symptomatic COVID infections by up to 90%. If you look closely at Israel, which has one of the most important successful vaccination campaign, Israel is one of the countries with the highest rate of COVID-19 vaccination, and they're the ones that has significantly achieved the herd immunity, resulting in significant drop of cases. I wish we can get to this point. This is what we are aiming for, that hopefully people will have that vision of pre-COVID era, wherein we can enjoy the beach without masks, without social distancing. People in Tel Aviv, because of their significant vaccination campaign, the authorities have announced that face masks for COVID-19 prevention were no longer needed outside. So they have already gone back to meeting friends and meeting their relatives and enjoying the outside air and beach without the need to worry about COVID-19. Clearly, therefore, we hope to propagate this information to most of us because we are already mentally tired from being socially distanced from our friends, from being isolated from all the different programs that we always want to do pre-COVID era. The added bonus in terms of news is that most of our COVID-19 vaccinations actually have data to support that they do work in certain COVID-19 variants, including the mRNA vaccines, the AstraZeneca vaccines, including SINOVAC, based on lab studies and randomized clinical trials. So for those of us who have been vaccinated with the first dose of SINOVAC, you are still not completely protected. You're only completely protected after the second dose. So what can you do once you're fully protected? You are fully vaccinated only after 2 weeks after the second dose, whether you're getting the Astra or the SINOVAC. You're actually fully vaccinated 2 weeks after a single dose vaccine, such as the Johnson & Johnson. If it has been less than 2 weeks since your first dose, or if you still need to get your second dose for the 2-dose vaccine, then you are literally not fully protected yet. So don't be complacent. Keep taking all the prevention steps until you are fully vaccinated. Now, once you have the full dose of your SINOVAC, then if you're fully vaccinated, you can now gather indoors with fully vaccinated people without wearing a mask. So within your family group, if all of you have been vaccinated, you can all gather together in one household or one gathering place without the need for social distancing, without the need for masks, because all of you have been vaccinated. You can also gather indoors with some unvaccinated people from one other household. For example, you have visiting relatives who all live together, but only from one other household without mask. However, if any of those people or anyone they live with has an increased risk for severe illness from COVID-19, then you cannot gather out with them. So what is important is, since not all of the people around you or your friends are vaccinated, you should still take steps to protect yourself and others in many situations, like wearing a mask or staying at least 6 feet and avoiding crowds on poorly ventilated spaces, and to always take these precautions in public because you really don't know whom among your friends have been vaccinated, whom among your friends are still unvaccinated. Very critical that you take precautions gathering with unvaccinated people from more than one other household, or take precaution when visiting an unvaccinated person who is at increased risk of severe illness or death from COVID-19, or who lives with a person at increased risk. So for those who are against vaccination, I hope I have provided you more data to support that vaccination do work. And if we want to go back to normalcy, it is but my appeal to all of you to consider vaccination. And if you have questions, you feel free to call us, to call your primary care physicians so we can guide you whether you are a candidate for COVID-19 vaccination or not. Remember, vaccination for all is our goal. For now, we are vaccinating those high-risk groups, the healthcare workers, the seniors, and our patients with diabetes, our patients with comorbidities like hypertension, because they are with comorbidities which put them at high risk to develop severe COVID. So by trying to vaccinate these high-risk groups, we are trying to stop the transmission and save lives. However, for those of you who are not on the priority list, please don't jump in the queue, because if you are young, you are healthy, you're at low risk group, you're, let's say, working from home, you're not in school, but you are just inside your household, then vaccinating you may not probably prevent any cases, because in the first place, you are at low risk. So not every vaccination, therefore, has the same value. Because of the limited supply of vaccination, we appeal that we prioritize those who need it most. Remember, the people who are eager to get the job are the cautious ones. What we don't like is, unfortunately, those who refuse to get the vaccination are most likely the people who really need it. Again, I'm Dr. Jerry Tan. Thank you and God bless.